I'm Juan Kaski, the Professor of Cardiovascular Sciences here at St. George's University of London. I run a fairly large research group, and one of our main interests is biomarkers of inflammation. SIESTA is a consortium that aims at identifying the role or the relative role of biomarkers of inflammation in the acute coronary syndrome. There are 32 hospitals in Spain involved in the consortium, and the Society of Cardiology in Spain has endorsed the activities of the consortium. St. George's Hospital is the coordinating center for this study. When we started thinking about the potential role of biomarkers of inflammation, we felt that we needed to actually create a group that would actually focus on understanding the relative role of these biomarkers, and that was the main objective, to know how much information these biomarkers would give us in addition to the information that is provided by the traditional markers of risk. So it was a very simple objective, to give the clinical people, the practitioners, a clear idea as to whether these inflammatory markers would have a role in clinical practice. The search for inflammatory markers, in a way, responded to this better understanding that we have now of the pathophysiology of atherogenesis, which is very much linked to the inflammatory process. So inflammation definitely plays a major role in both the origin of the atherosclerosis as well as the progression of the atheromatous plaques. So a vital role for inflammation in the pathogenesis of coronary artery disease. Cardiologists are quite used to employing biomarkers of risk. Amongst the most successful biomarkers, I would list probably the cardiac troponins, which are markers of necrosis, which have been extremely important in defining the presence of this problem, and also they have been shown to have very important prognostic value. So a marker of necrosis tells us how much damage the blockage of an artery has caused to the heart muscle. And there are other markers which are very, very important and tell us about the ability of the heart to pump enough blood. In other words, to tell us whether the heart is sufficient or insufficient. And this is a group of peptides, BNP being probably the most common, or NT-proBNP. Again, this is a marker which integrates a number of elements, and for this reason seems to be quite a useful marker of prognosis. And there are some studies which actually are telling us that it can be also useful to guide therapy in heart failure. Inflammatory markers measure a slightly different pathway, and it is essentially the pathway that relates to macrophage activity, atherogenesis, etc. So I think what SIESTA has actually shown is that when you combine the three, you may actually increase your prognostic ability over and above that information that the other markers give you.